Hello everyone, welcome to this video in which we are covering the microbial diseases affecting the urinary system and the genital system. So as I promised, it will be a very summarized video. We are not covering all the diseases. There are much more infections and microbial diseases of the urinary and the genital system that we are covering, but we are just focused on some examples. So let's start with the structure and function of the urinary system. So as you can see, the urinary system includes two kidneys, two ureters, and the urinary bladder, which you can see it here, and then the opening, which is the urethra, or the tube that collects the urine from the urinary bladder to be discharged outside the body. Infection is prevented by, and this is what we have followed in all the previous lectures. So giving an overview about the structure of the system, and then how is the infection is normally prevented. So in the urine, number one, the urine is acidic, and this is not favoring the growth of many organisms. Number two, we have many valves that prevent the backflow of the urine back to the kidneys. So imagine here in the ureters, we have something like gates, so valves that closes. So let's imagine something like that. So we have something like valves that prevent the backflow, and this is important to prevent infection going back to the kidney. So it's like one-way direction. Once the urine is released from the kidney, it will be allowed to move in one-way direction till it is discharged from the urethra. So these valves, in addition to the acidity, and the third one is the mechanical flushing. So always these structures that we are discussing are always frequently flushed with urine. So any microorganism being there will be flushed away. Any toxins released by this microorganism will be diluted by the flushing effect of the urine, and this is the third mechanism to prevent the infection. However, despite these three main mechanisms, we still get some microbial diseases of the urinary system, and these diseases I have summarized them in this slide. So we have pyelonephritis, and pyelonephritis means infections or inflammation that will take place in the kidneys. So pyelonephritis is related to the kidney. Then cystitis, which is the inflammation that is happening in the urinary bladder. And finally, urethritis, which is the inflammation that is happening in the urethra. So these are the three main urinary tract infections. And as you can see, here are the locations taking place through these infections. So let's start with the bacterial infections. We normally have the coliform, as you know, in the GIT. So we have the intestinal coliform, and these are opportunistic. Once they are in the intestine, that's fine, no problem. But once they get an access to the urinary system, here the infection will start. And usually we see these kind of infections caused by coliforms in females more than men. So females, they have 8 times more tendency to develop coliform related urinary tract infection than men. The reason behind that is that the urethra in the females is being closer to the anus. So as you know, these coliforms are in the GIT, so they can be shed with the feces from the anus. So if we have the urethra very close to the anus, that will increase the tendency or the chances for this coliform to get an access to the urinary tract. And that's the case with females. So because of that, they have 8 times more risk than men in developing these urinary tract infections. So this is first reason. Second reason, it may result from nosocomial infection. So nosocomial hospital-related infections. So usually in individuals with catheters, urinary catheters, they develop urinary tract infection, bacterial infection. So what are the symptoms? It will be dysuria, so meaning that it is painful, difficult, and urgent urination. So these symptoms will be collectively called as dysuria, or pyuria, meaning that we have pus and white blood cells in the urine, making it cloudy. And to diagnose these cases, we will take a urine culture, and then we will do colony count. So we will count the number of bacteria, CFU per mil. So CFU, colony forming unit per milliliter. So collecting the urine, and here you will have two approaches to collect the urine. One way to do that is through catheter. So this is a way that collects better sample because it is not contaminated with anything, but it is invasive, and because of that, most of the patients will not prefer having a urinary catheter. The alternative would be what we call CCMS, clean catch midstream. So while the patient is asked to urinate, they will collect the midstream of urine. So they will catch this midstream of urine and collect it in like a specific sterile jar, and then send for the colony count. So there are some considerations regarding the method that you will use, and also some consideration regarding if the patient is male or female. Then you can also do some sensitivity testing in order to know your bacteria is sensitive to which antibiotic, and then treatment will follow. Usually we start with the combination of trimethoprim and sulfamethoxazole. So trimethoprim sulfamethoxazole is available in the market under the name Spectra, for example, and some other trade names. So these are combination that usually give very good results in terms of eradicating the urinary tract bacterial infection. So let's summarize the types of infection. We said we have cystitis, which is inflammation of the urinary bladder. Usually it is caused by E. coli. So E. coli is at the top of the causative agent, and as you can see, it is like highlighted in bold. So E. coli is one of the top reasons, and you know now why, because of it is a inhabitant of the GIT, it's a coliform, and because of that it can be released from the anus and get an access to the urinary tract system. In addition of that, we have members of the species of Staphylococcus, not aureus, so it's not Staphylococcus aureus. Staphylococcus aureus, we have discussed it in other infections like skin infection, for example, but here other species, for example Staphylococcus saprophyticus, and we have Enterococcus in case of nosocomial infections and other opportunistic coliforms. In case of pyelonephritis, which is the inflammation of the kidneys, again we have E. coli. This is responsible like for 75% of the cases. So as you can see, E. coli is one of the top causative agent of urinary tract infections. So this quick summary brings us to the microbial diseases of the reproductive system. So we will compare quickly the structure of the female and the male reproductive system. So I will not go into details, but I will leave the slide for you to go through them. And this is one thing that we have covered in the previous slides. So so here we have the anus, if you remember, in the female, and we have the urethra here. So as you can see, the close proximity between the anus and the urethra, this makes the female more susceptible to coliform related urinary tract infection. Okay, so leaving the urinary tract infection, and let's focus on the reproductive system. We'll find that the female vagina is acidic. So this is related to the presence of lactobacillus bacteria there. So that this is the normal microbial flora in the female genital system, in the female vagina specifically. So because of the fermentation of sugars, lactobacillus will produce an acidic pH, and as we said before, this will encourage mainly the fungal infection more than the bacterial infections. As you know, because fungi can withstand, or actually it prefers acidic pH for their growth. Moving to the male reproductive system, here we don't have the problem of the anus being closer to the urethra. As you can see, the distance is much longer. And if we compare the microbiota in the urethra, so the urethra is usually sterile in male. So comparing the female and male reproductive system, the female contains lactobacillus, the male is usually sterile in their urethra. So the urethra is usually free from microbiota. So let's get an idea about the diseases that affect the reproductive system. So usually the mode of transmission is being sexually transmitted diseases. So usually, or at the beginning, they were using the term sexually transmitted diseases, STDs, and then since many of them, they don't develop symptoms, so they have replaced this term with sexually transmitted infections, because this is actually describe it in a better way than being a disease. It's actually an infection. Then, as you can see, how can we prevent them? By abstention and by using condoms. And for treatment, we have different types of treatment depending on the causative agent. If it is a bacterial infection, so antibiotic. Then if it is a viral or fungal, so we can use antivirals or antifungals if needed. The majority of these infections are reported to the CDC in order to keep track of the spread of this disease in the population. And once we move into the bacterial diseases or the reproductive system, we have on the top of these diseases the gonorrhea. So gonorrhea is a disease caused by Neisseria gonorrhea. Then we have non-gonococcal urethritis. So gonorrhea will cause gonococcal urethritis, but there are some other bacteria causing this urethritis. So they are non-gonococcal urethritis. And an example here is the chlamydia trachomatis. Then we have pelvic inflammatory diseases, PID. Again, we will mention Neisseria gonorrhea here as well, and chlamydia as well. So as you can see, both organisms, they are responsible for causing urethritis, and they are responsible for causing PID, pelvic inflammatory disease. There are other bacteria. We are not going to cover them. For example, there is the syphilis caused by Treponema pallidum and some others, but we will not cover this. We will just take gonorrhea as an example.